Okay, moving right along. Number 5. How do we get rid of genital wart?
Okay, well, just my little quick microbiology lesson again here. So genital warts, as we know, is caused by the human papillomavirus. There's over 100 types of human papillomavirus, or HPV, and only 2 types, type 6 and type 11, cause 95% of genital warts. So the HPV virus that causes things like cervical or anal cancer are different types. And that's why in some ways, and the sort of more common warts that you get on your fingers and other parts of the body, and young children get them, mostly are not sexually transmissible. There might be a really small number of cases where people think that that has been the case, but we're really talking about 2 types of HPV that cause the great majority of genital warts. Now we've got again an Australian discovery or development of the vaccine, and we've seen a dramatic reduction, almost to zero, in some sexual health clinics, presentations of genital warts, because the HPV vaccine covers type 6 and 11, and that's not all of them do, sorry, but the one that was rolled out in Australia covers type 6 and 11. So that has kind of eliminated genital warts for the great majority of young people. However, if you've been unfortunate, if you're older, or if you've been unfortunate enough to have had genital warts, in a way like the herpes virus, they don't go away. They last, that the virus can last for decades. We do think that natural immunity eventually eliminates the virus from the body, but it is a virus that can just survive in the base layer of the skin. And it might flare up again sometimes when you're under stress or your immune system's just a little bit down. Pregnancy is a good example of that. So pregnant person, their immune system alters a little bit, and sometimes that's when we have seen genital warts flare up, and that can be quite dramatic sometimes. So to get rid of them, so there's prevention, but to get rid of them if you do have them, if the first line recommendation is they're prescription medications, but there are 2 types of prescription paints or creams that you apply directly onto the wart, and the person with the warts does that themselves. They don't need to go, they get a prescription, but they don't need necessarily to have a clinician apply that for them. They can do that themselves. And then the other method is that commonly happens in sexual health clinics, and I certainly did a lot of that when I worked in a sexual health clinic quite a few years ago, is cryotherapy, so freezing them off. And it usually takes, 2 or 3 treatments before they heal, but there's a really good success rate of the warts actually being healed. And then there's a smaller percentage of recurrence of warts, and you can go back and keep on having them frozen. There are other treatments that involve surgery and sort of what they call ablation. So there are other kind of slightly more invasive techniques that can be used in kind of quite severe cases. But the most common forms are these topical treatments with, there are 2 types of drugs that will sort of destroy the warty tissue, and freezing them, or cryotherapy.
Wonderful. And I think the really hot tip there is don't try to self-treat with an over-the-counter wart off or something like that, because it's probably going to do more damage to your genitals than curing that virus itself. So, or managing and treating that virus itself. So thank you for that one. And great now that we have less young people experiencing genital warts.